but it is typically, often in most states, not tied to the cost of children learning standards. And I think one of the things that's sorely needed in Virginia is a commission and a study to examine the effects of the formula and how it's not working. Because I think what would become clear, and what numerous reports have already said, but at least if you get it from sort of the legislature, you might maybe get some action from them, is that you need to understand that the formula needs significant updating. Allowing the less funding to low-income communities is something that's proven to be ineffective. And so there are definitely ways to require states to develop formulas that are tailored to ensure that all children get an excellent education. Virginia is simply choosing not to do that. So I would say New Jersey is a good place to look in terms of a funding model that has gone through a lot of examination and has been held to be focused on meeting the needs of children in the state.
To move on to the healthcare panelists, but I did want to add that we'll have, I think, at the end, time for some cross-pollination of questions. So if you have a burning question you want to ask about education, because there's such a close overlap between these different areas. So let me introduce our panelists for healthcare. First, we have Ross Arrington, who is a senior health policy analyst and political commentator, and also an adjunct professor at the VCU School of Allied Health Professions and VCU School of Nursing. He specializes in the Affordable Care Act and its impact on both the healthcare safety net and the Commonwealth of Virginia. He also advises universities, government agencies, corporations, and nonprofit organizations on health reform and policy issues. Our second panelist is Peter Cunningham, and he is a professor in the Department of Health Behavior and Policy at VCU, specializing in the U.S. healthcare system. His studies and publications focus on a variety of things, including insurance coverage, access to healthcare, medical costs, strategies for expanding medical coverage, and reducing access disparities among Hispanic immigrant and minority communities in particular. And then our final panelist is Jill Henkin, director of the Center for Healthy Communities and Enroll Virginia, and she concentrates on health law as well at the Virginia Poverty Law Center. She engages in public policy health advocacy on behalf of low-income Virginians, supports health reform legislation at the national level, and provides local health law training to legal services staff, private attorneys, and outreach workers. So please welcome our panelists.
Good evening, everyone. I'd like to begin this portion of our evening with a moment of silence for the recent tragedies that took place in Sweden and Norway. Very disrespectful. Sad. When I was invited here, Crystal called me and asked me if I would come and speak on healthcare, and I looked at the list of the other panelists, saw how distinguished and accomplished they were, and I said, why, when you've got Jill Henkin and you've got Peter Cunningham, would you invite me? I've only been doing this for a couple of years. And she said, Ross, we're trying to make this look like a balance event. Everybody already thinks you're a Republican, so you might as well just come on. All right, so before I let the much more knowledgeable and accomplished folks come and speak, a lot of what we talk about with the future of the Affordable Care Act, also known as Obamacare, a lot of people also think those are two different things. A lot of what we talk about, and a lot of the context in which we talk about it, is uncertainty. Whenever you talk to anybody, you say, what's going to happen to Obama?